Good afternoon, everyone, and welcome to our week 2 class meeting for module 154. Um, we are a week in now, and y'all have gone through chapter 12 and are starting on chapter 13, I think, today. Because the 12 exam was yesterday, if I remember correctly. So today what we're going to do, since we're getting right in between chapters, we're going to talk a little bit about the highlights of chapter 12 and a little bit about what you guys are about to see in chapter 13, which is a really interesting chapter, and it contains some stuff that you're not going to see anywhere else, um, because it's surgery. It's dealing with surgery coding. So it has some specifics, and it covers a few different chapters in our CPT manual. So let us jump right in, and I'll switch it over to our presentation. All right. So week 2 of what is going to end up being about 8 weeks, guys. 40 days in this module. It's the long one. So we're going to cover some quick announcements, go over a little bit in chapter 12 and chapter 13. And I'm actually adding to this. I've decided I'm also going to do, after we finish 12 and 13, I'm going to give you guys some tips on the exams that you're going to see in chapter 154. Some things that are just going to help you out on your first shot on the exams. And then we'll open it up for any questions or concerns that you guys may have today. All right, so announcements. As discussed yesterday, for those of y'all that were there, next week on our Wednesday coding class, we are going to start doing CPT, or I'm sorry, ICD-10 as a refresher to those of y'all who have already been through that, and as an introduction to my brand new students that started in the last few weeks who've not been through ICD-10 yet. And that way y'all can kind of follow along and figure out as we go what's going on. And then once we wrap around and y'all do go through the ICD-10 manual or the ICD-10 section, y'all will have it down already. You're going to have a good base knowledge on that. So next week, please bring your ICD-10 manuals in preparation for that, okay? We're going to switch from CPT to ICD-10. The blackout, we still do not have dates for that. I will let y'all know as I find out things, but we don't have any updates at this time. I know a lot of y'all are experiencing a lot of errors and things in the My Unitech site. And again, that's what the blackout is about, is updating that system to get rid of some of those. But again, we still don't have dates for that. And last but not least, down there at the bottom, I manually grade your exams. Y'all, please stop texting me when it marks y'all wrong for things like capitalization or misspelling or whatever. I do not mark those off. I correct those as I go through your exams. So please keep in mind that I have almost 50 students, and it marks the same ones wrong for every single one of y'all, no matter what y'all put in the blank, whether it's right or not. It marks some of them wrong, which is why I manually grade your exams. So please don't bother emailing or texting me those what it marked you wrong for. I will see it when I go through. If I have graded your exam and I didn't catch it, by all means, then contact me and let me know what I missed, okay? Because I'm human and I do miss things, but not often when it comes to your exams, okay? So just let me grade it once before you reach out on those errors and stuff, okay? And that's it for announcements, as far as I know. Our Zoom classes are going to be just us for the next little bit. I was informed of that this morning. We're not going to be doing any more group ones for a little while. I'm not sure why, but that's what I was told, so that's what we're going to run with. All right, so chapter 12. In chapter 12, y'all read up about anesthesia, um, about the anesthesia chapter in the CPT manual, right? So just some of the highlights, guys, because like I explained to y'all, the textbook is going to go through each chapter and give y'all a lot of information about it, some of which you don't really need to know, and some of which is not really ever going to be relevant to you in your work position, like anesthesia. Unless you go to work for an anesthesiologist specifically, you're probably never going to see this information again. But it is good to know a little bit about everything. So we're going to talk real quick about anesthesia and some of the highlights. So anesthesia means the induction or administration of a drug to obtain partial or complete loss of sensation. All right. So most people know what anesthesia is just from going through life. We've had surgery, we've known somebody who's had surgery and undergone some type of anesthesia. That's what we're talking about here. An anesthesiologist is the person that, or there's also an anesthetist that administers anesthesia. Okay. Analgesia is the absence of pain, which is achieved so that a patient may have surgery or procedure performed without pain. An example of this might be like, okay, I get the occasional skin cancer on my shoulders or my face or something like that. I go to my dermatologist. He puts an analgesic, a pain, like a, what do you call that stuff that numbs it on the outside? No, not like Novocaine's what you use in your mouth, but lidocaine.
Lidocaine.
There you go.
Lidocaine. Oh,
That's what I'm thinking of. Lidocaine. They'll numb it with some lidocaine and then do a shot or freeze it or excise it, whatever they need to do. That's what we call analgesia. When they've reached that level of numbness where they can do what they need to do without causing me a whole lot of pain. And I tell y'all what, they do a good job because I've had a spot removed from my shoulder that was huge. I have a huge scar from it, and I was awake for the whole thing, never felt anything till it wore off. So that's what they mean when they're talking about analgesia. Let's see. Some of the different types of anesthesia are good to know, just in case y'all go to work for a hospital, a general practitioner, anything like that where somebody has undergone anesthesia. Sometimes they do it in office. All right, so endotracheal anesthesia is accomplished by insertion of a tube into the nose or mouth and passing the tube into the trachea for ventilation. That's pretty much exactly what it sounds like. They take a tube, put it down into your body, and administer your anesthesia that way. Epidural anesthesia is the injection of an anesthetic agent into the epidural spaces between your vertebrae, also known as peridural or epidural block. These are most common, guys, for women who are having babies. You want that epidural. Most women want that epidural. Some women are soldiers. Good for y'all. That wasn't me. It was not me at all. But that's what we're talking about. We're talking about epidurals, that injection into the back that lowers the bottom half of the body, or they can put it wherever they want to numb whatever part of the body that they need to numb. Spinal or intraspinal anesthesia refers to anesthesia produced by an injection of local anesthetic into the subarachnoid space around the spinal cord. All right, so a little bit different than epidural, right? The epidural injection of an anesthetic agent into the epidural spaces between vertebrae, that's in between the spaces in your spinal column, right? And the spinal shoots fluid into the space around the spinal cord. If you think of your spinal cord and think of it like there's kind of a sheath going through it where it's contained in a bunch of fluid and different things, muscles and all that, it's that space in there. Okay. To continue on with the types of anesthesia, general anesthesia is a state of unconsciousness that is accomplished by the use of a drug or combination of drugs administered intramuscularly, rectally, intravenously, or by inhalation. And general anesthesia is what they give you when you're going into surgery to knock you out, right? That's going to be your general anesthesia. Whether that they may get, put something in your IV, make you hold the thing and count backwards. However they choose to go about that process, that's what general anesthesia is. Um, I think general anesthesia is the most common, most widely used. Regional anesthesia interrupts the sensory nerve conductivity in a region of the body and is produced by a field block, forming a wall of anesthesia around the site by means of local injections or nerve block injection of the area close to the site. Nerve block is also known as block anesthesia, or conduction anesthesia. Okay. And what they're talking about, an example of regional anesthesia, is when they're trying to work on one particular part of your body. So they will do injections around the nerve center of that part of the body to numb just that part. They don't want to knock you completely out. They don't want your entire body numb, but they need this particular part to be as numb as possible so they can do what they need to do. That they pinpoint that region of the body, regional anesthesia. Okay. All right. Local anesthesia can be accomplished by means of application of an anesthetic agent such as lidocaine, placed directly on the area involved. Let's see, move my little deal. Topical anesthesia, or local infiltration through subcutaneous injection of an anesthetic agent. Okay, so that is very similar to what we talked about a second ago with the when I was talking about my skin cancers. They could also use a local anesthetic for that as well. And they also talked about moderate conscious sedation in that chapter, just a little bit, but just enough to let you know that it's not coded in the anesthesia section, right? General conscious sedation, because of the type of medicine that they use to achieve that effect, is going to be in the medicine chapter of your CPT manual, not anesthesia. And that's basically, guys, that's what I wanted to highlight in chapter 12, just so y'all have an idea going in what the different types of anesthesia is out there, what you're going to see in paperwork and things like that. All right, so chapter 13, surgery guidelines and general surgery. All right, so this is the chapter that y'all are going into, and it's one of the biggest. Okay, the surgery section is the largest in the CPT manual. The codes range from 10004 to 69990. So that's like half the book, right? That's like a large portion. If our codes are only going from 0 to 99999, you're covering everything from 1 to almost 69990. That's a pretty big section of the book. Okay. Surgery is divided into subsections. Most surgery subsections are defined according to medical specialty or the body system. Within the surgery section, some of the more complex subsections are the integumentary, musculoskeletal, respiratory, cardiovascular, digestive, and female genital subsections. All right, so that is all well and fine to say, but I wanted to put it in terms that y'all could really break it down to, okay? The way I have my manual tabbed, I actually have it tabbed by body section, okay, by chapter, essentially, like integumentary, musculoskeletal, respiratory. Those are all things I have on my tabs. Some people use the code ranges, all right? So after anesthesia in your CPT manual is integumentary. And then right after that is musculoskeletal. Right after that is respiratory. They're right all together, guys. Everything in surgery is one after the other. All these different sections in your CPT manual are right next to each other, one after the other. Okay. So that's where you're going to find the codes that you're going to be using in that chapter. If y'all start doing chapter exercises or on the exam or something, you find a code that's outside this range, 1004699990, that's probably an incorrect answer. That's a clue that that's an incorrect answer. Your codes are going to be in this range for this chapter. Okay. Now, that's a pretty big range in the book, right? But if you come up with something outside that, you'll know that you're looking at possibly the wrong thing, and you can point yourself in a different direction. All right, so one of the other things that y'all are going to see in the chapter 13, one of the things y'all are going to cover in surgery is called the surgical package. You're going to read about that maybe tomorrow, maybe on Monday, but I have a whole different little presentation that is just the surgical package in chapter 13. I am actually going to be attaching this to probably one of your labs over the next few days. Probably Monday or Tuesday, y'all are going to see this. You'll see it before the test, okay, and get to work on it. But when you're going through it, I'm going to post all the little slides. It's a little activity, basically, okay? It's a presentation and then an activity. It goes into what the surgical package is, what's included, what's not included, like general anesthesia. This is billed by an anesthesiologist, follow-up care, etc. This presentation is gonna walk you through all this. What a global period is, that's something you're gonna read about in the surgery section, because most surgical procedures have a global period, and that is just a time frame, possibly sometimes before, most of the time after a surgical procedure, such as 90 days or 10 days, depending on how serious the surgery it is, where office visits and things, like anything done in there that had to do with that procedure, are included in the cost of the procedure. They're not billed extra. That's what a global period is, okay? And there's like certain charges that have to be filed within the global period to have them covered, and things like that. So very important information there. And then the activity, you're going to go through the following slides and determine whether the item or service is part of the surgical package or not. You're going to upload a document that just lists out your answers. Just 1, 2, 3, 4, 5, yes or no. Is it included in the surgical package? Yes or no. And you'll see kind of, let me show you an example. Is this included in the surgical package? This is a surgical tray. Just off the cuff, anybody want to guess the answer to this? Would this be included in the surgical package? The surgical tray?
I think so.
You would think you would be correct. That's correct. There are things included that sometimes you wouldn't think of, like pre-operative x-rays, post-operative care for an infection or something like that. Different things. So you'll go through, and it's not a ton of them, guys. Maybe like an E&M office visit for 6 months pregnant. Is that included in the surgical package for labor and delivery and things like that, right? Second unrelated surgical procedure during the global period. But reading through chapter 13 will give y'all a better idea of what is and what is not and why, okay? And like I said, you're going to see that in your labs. Usually I do a whole live lecture based on this presentation, but the way they're falling for this one is just not, it's not working out. Like, we're right in the middle of chapters, and I don't want to hit y'all with this before y'all have read it, but I don't want you to go into it blind either, you know? So that's why I decided to do the kind of the highlights on 12 and 13, and I'll let y'all do that as an activity in a lab. And then we'll talk more about it next week. Okay. Any questions or concerns at this point? No? Good deal.
No, ma'am.
Awesome sauce. Okay, so I did want to talk real quick, just a couple of tips and tricks about the exams that y'all are going to see. going through module 154. There is going to be coding, and they're going to ask for CPT, and they're going to also ask for ICD-10. And they will always, almost always, guys, no matter whether your answer is perfectly correct and matches what they say or not, most of them where you have to fill something in, they mark wrong. That's why I manually grade your exam. But one of the ways you can kind of combat that is always on your ICD-10 codes. They begin with a letter, right? Not a number. Make sure that that number is capitalized. Always, always, always. It's never a lowercase letter. It's always a cap. Okay. So that's one thing. And as we're going
Well, mine, I'm sorry, I put the correct answer on mine with the capital letter N. It said it was lowercase.
like I said, usually on those ones where you're filling in something, it's going to mark you wrong no matter what you do. No matter what you do. That's why I go through them myself and I look at every single one of your answers, and grade it accordingly. So don't stress about that. But that's just one of the things. Capitalizing that ICD-10 code. On some of the short answer stuff, it doesn't matter whether you capitalize it or not. Like I think the final exam had something where you had to put place of service and type of service. And I saw people who capitalized it and marked it wrong. I saw people who lowercase it and marked it wrong. And it no rhyme or reason as to why it marks it wrong. It just does. So I went in on every single one of y'all's and corrected it. That's just part of my job. I know that. So that's not a big deal. But one of the things to check into is pay attention to the code ranges that we're in. Because like I said earlier, if we're working in the anesthesia, like just for chapter 12, if we're working in anesthesia and we're coding anesthesia, and when you get to your exam, you're doing the exam, and when you pick out your keyword and you go through the whole thing, and you come up with a code that is not in the anesthesia section, it's probably the wrong answer, right? It's probably the wrong answer. So pay attention to those code ranges and what chapter your test is on and where those answers are going to be coming from. I see some people who will get, and this is another thing, y'all think I can't tell when y'all do it, but I can tell when y'all stop at that alphabetic index. Always verify in the tabular. Always. Even though CPT is pretty straightforward, most of the time it's going to take you to the correct code. You still want to verify. Always. Always. That is a firm rule that every instructor here harps on. Always. You cannot stop at that alphabetic index. You have to verify in the tabular. Have to. That's just like, that's one of the golden rules. Always verify in the tabular. Another golden rule: we do not code what we do not know. We do not guess. Okay? We gather all the information we can gather and we make the best call that we can, the most accurate call that we can. But we do not guess, and we don't code what we don't know. If it's not in billing and coding, if it's not documented, it didn't happen. And if it didn't happen, we don't code it. So just some basic things to keep aware of. I hate true or false questions, so y'all are not going to see a lot of those. There may be a couple thrown in. Most of your stuff though is going to be multiple choice and or coding. And again, my new students that have not been through ICD-10, if y'all do not want to attempt those codes, don't. just put new student. Don't attempt it if you're not comfortable with it. If you are comfortable with it, you want to give it a shot, give it a shot. And if you get it wrong, I'm not going to hold it against you. Okay? But you are not responsible for it if we've not been through that material yet. Okay? So just keep that in mind. For the most part though, there were some of y'all that were not responsible for the final exam for module 153. You took it anyway and you did good. You did really well, for only being in that module for a week or two. So kudos to those folks. Kudos. But overall, y'all are doing really, really great. But that was pretty much it. Just, watch your code ranges to make sure that what you're putting in is, in the chapter that we're working in. And don't worry about when it marks you wrong and you know you got it right. Don't worry about it. I'm gonna catch it on my side, and if I don't, then you worry about it. Okay. Let's see. Anything else we need to talk about today? Do y'all have anything for me while I'm trying to think if there's anything else? I don't think there is. I think that was pretty much it for today. Anything? No, we're good. Everybody's good. Man, y'all making my job easy today. Really easy. Really easy. Okay, well, I can't think of anything else that I have for y'all. As y'all are going through chapter 13, you know, you can always reach out if you have questions, concerns, anything like that. And that's pretty much it. That's pretty much it. All right, so if y'all don't have anything for me, guys, y'all have a very blessed evening and a great weekend, and I will see y'all next week.
You too.
Bye bye.
Mm.